Hey, it's Dr. Lowenstein. Today's Wednesday. I have not done Facebook Live for a while because I've been slamming busy. But I just saw our post-ops from yesterday. I had a cool day yesterday where what we do in the morning? Breast augmentation and VASER liposuction. It's a woman who was very athletic and really strong. Works out like 12 days a week, but had these little kind of pockets of fat in the flanks and a little bit in the upper abdomen, a little bit up here in what we call the anterior axilla. And we knocked all of those out of there with VASER, and it turned out great, and put in really nice, smallish breast implants, to give her a nice shape. She didn't want to be big, but she looks kind of natural and like they're her own, which is what I like to do. And we were actually planning on doing a breast lift at the same time. But again, I've talked about this in the past, kind of intraoperative judgment. When we went to, we sat her up with these implants in, and I thought her breast looked great. We don't need to do a lift because, even though we planned on it, I didn't think it was necessary, so we didn't do it and gave her money back. And today she looks great. I think it was a good decision. And then we did an abdominoplasty, and I've talked about lipoabdominoplasty versus straight abdominoplasty in the past. This was a very tall, thin, very active woman whose lower abdomen kind of pooched out, but she wasn't fat. It was just because the muscles in her abdomen had been stretched out with the pregnancies. And she flew in from overseas for her surgery. And she did great. We didn't do a lipoabdominoplasty with her because fat's not an issue, but I took out a bunch of skin, and most importantly, I addressed the muscles underneath her skin and flattened them out so we wouldn't have that kind of bulge there anymore, and you could bounce a quarter off her abdomen this morning, and she's really happy and everything's good. So that's that. Tomorrow I am operating on a young woman with occipital migraines. We're going to try and cure her migraines, and then I'm doing upper and lower eyelid surgery, a cheek lift, lower face and neck lift. And so it's going to be another busy day tomorrow. Busy day in the operating room is always good. So I, again, just kind of back saying hi. And my point of the day, what should be my point of the day? I think my point of the day is that I need a haircut. And I'm going to try and do that this weekend. But I haven't had time to go to get my hair cut because